Hello, my name is Caroline. I'm one of the physical therapists here on the team. I am going to spend about 15 minutes explaining to you what we are wanting you to do between now and surgery to make your recovery easier and safer, along with what to expect from physical therapy while you are here in the hospital after surgery. Our job is to make sure you are safely able to do the things you need to do to return home after surgery. The first thing we want you to do today, while it's still fresh in your mind, is to go home and walk through your house as if you have a walker. They are usually about 25 inches wide. You will need to make sure there's room for the walker between the bed and the wall or the dresser. There's room to get into the bathroom and into your living room seating area. Sometimes you might need to remove the bathroom door and hang a curtain, or move the recliner so you can fit the walker between it and the sofa in your TV area. It is much easier to do this now before surgery than on the first day you get home after surgery. The second thing we want you to do the night before surgery is to pick up your throw rugs. We understand that they serve a purpose. They cover marks on the rug, they keep dirt from getting in the house, but they really increase your fall risk with the wheeled walker. You are going to have a phenomenal surgery. It is going to change your life, but we know you don't want to fall and have to have it again. So pick up those throw rugs, throw them in the closet, and put them back out again when you're done using the walker. If you have more than 2 steps going into your home, try to make sure you have at least one rail to get up those steps. If you need a walker to rely on to walk on level surfaces, you can see why we want you to have support from a rail going up your steps. Please take out the exercise handout from your folder. You will notice the handout doesn't quite match the slides, but you should be able to follow along. We want you to do these exercises not so much to strengthen or stretch things, but to teach your brain and your muscles what you will be doing after surgery. It is much easier to learn these now before surgery than it is after surgery. We want you to get to the point that these exercises are automatic so that when you start doing them after surgery, you know exactly what to do. As the pictures show, we want you to do these laying down on the bed, sofa, wherever you can be relatively flat. The first one is the ankle pump. Our nursing presenter explained the importance of these for circulation, but we also want you to start doing them before all your leg exercises because it helps start moving the knee and the hip joint and all the muscles up your leg. With your knee straight, you pull the toes all the way up and push them all the way down, bending your ankle and repeating. This exercise introduces motion, so we want you to move at a moderate speed, not slow and no holds. The second exercise is the quad set. Your quads are the muscles on the front of the thigh. You can bend your opposite knee like in the picture to protect your back if you need to, but otherwise, with the knees straight, press the backs of the knees down into the bed or the sofa, hold for a few seconds and relax. If you're having a knee replacement and your knee doesn't go straight, place a small pillow or a rolled towel under your knee to fill up the space under it and give you something to press against. The third exercise is the gluteal set. Your gluteal muscles are your buttocks muscles, and you are essentially going to squeeze your buttocks together, hold them for a few seconds, and relax. These first 3 exercises don't really move your hip or your knee very much, but they get the muscles warmed up and keep things from getting stiff. The next exercise, we start moving things. The heel slide. You basically start with both your legs flat and slowly pull your heel up towards your rear end, bending the knee. You might not be able to bend it much because you need surgery, but bend it as much as you can comfortably and make sure you can do it with your other leg too, so your brain learns the right motion. After bending, you slide it back down flat and repeat. No holds on this one. The straight leg raise is very important to help you get out of bed, as your leg may feel very heavy after surgery. With one leg bent, I want you to keep the other knee straight as you lift and lower the leg from the bed, no more than 12 inches or so. It's very important you keep that knee straight while you're lifting and lowering. We understand that you might not be able to raise it very much right now, especially if you need a hip replacement, but do as much as you are able and then make sure you do it with the other leg also. Hip abduction. Keeping one leg still, slide the other leg out to the side while keeping your knee straight. Do not lift it. Slide it out, then slide it back in towards the other leg, remembering to keep that knee straight. Do not move both your legs at the same time. If you're having your hip replaced, you may only be able to move it about 1 inch. That's okay. Do that and make sure you repeat it on the other side also. if you are having your knee replaced and this exercise makes your knee hurt a lot, we don't want you to do it. Sometimes the knee cannot stabilize enough and it puts too much stress on it. That said, we don't want these exercises to increase your overall pain. They may be uncomfortable while you're doing them, but if you end up needing more pain medications or not being able to sleep as well because of increased pain, try to decrease a little. Instead of 10 repetitions, do 5. Instead of twice a day, do once. We don't want you to come into surgery with increased inflammation. We just want you to be more aware of your exercises. Now for the sitting exercises. Seated knee extensions. You are going to sit on a surface that supports your whole upper leg or thigh with your foot barely resting on the ground or not touching. If you are taller, you might need to use a recliner, the edge of your bed, the kitchen counter, whatever works for you. Without lifting the knee, you are going to raise the foot and straighten the knee as much as you can, hold for a few seconds, and then lower it with control. Seated push-ups are strengthening exercises for your arms. You are going to be using your arms for everything, sitting up out of bed, standing up, and supporting on the walker with every step you take. We have people who need to rest because their arms get tired, not their legs. So we want you to sit with your feet flat and square on the floor and do push-ups with your arms. If you have shoulder problems, start at the top and do little dips. Once you can do 10 repetitions easily, take the leg you're having operated on and place the foot out in front of you and do the push-ups with your arms and the other leg. Remember, we want you to do these exercises before surgery so you will be better able to do them afterwards. When will you be seen for your physical therapy visit? You may be seen either the day of surgery or the day after, dependent on your surgeon's order and your recovery from anesthesia. What do we do in physical therapy? In your first visit, we are going to ask you how you were doing before surgery. Did you use a cane or a walker? Did you need help with anything? Then we are going to find out what you need to do to go home. Do you have steps? Do you have grab bars in your shower, an elevated toilet seat, any equipment to help you be safe when you return to your home? Once we know how you were doing before surgery and what you need to do to go home, next we assess what you are able to do right then. We check how much help you need with sitting up out of bed, standing up, and walking. You will use the walker that is in the room. We will adjust it to your size. That walker will stay with you in your room while you are here and be your walker. If you have your own walker, we will want you to bring it to the hospital so that we can measure it properly to your height. If you don't have a walker, do not go out and get one before surgery. While you're here, our case managers will assist you with obtaining the correct walker. With your walker, once you've stood up, you might take a few steps. You might walk in the hallway, depending on how good that leg is working for you and how you're feeling after the anesthesia. If you're walking very well and safely, we may try steps with you in that first session. Occasionally, some patients experience side effects of anesthesia, such as lightheadedness, dizziness, or nausea. If this happens at any point in the progression of your session, we will assist you to the recliner or the bed, depending on where you are at the time. We ask you not to get frustrated and understand that this is most likely just the effects of the medications or anesthesia, and it will be better the next time we see you. We want to make sure you are safe. Once we determine what you are able to do, then we will establish your plan of care, which will outline the things that need to happen in order for you to return home safely. The number of visits you have with physical therapy depends on your specific needs. Some patients may only need one session, others may need more to reach their discharge goals. Your individual plan of care will be tailored to your individual needs for a safe discharge. While you're here, we will see you 1 to 2 times a day, depending on your progress and your goals, until you are safe for your discharge. Your schedule may be different from day to day. We will communicate with nursing throughout your stay to make sure you're ready for your therapy sessions. We want to have your undivided attention for your first physical therapy visit. It is hard to concentrate on physical therapy if you need to use the bathroom. Therefore, we ask you to please allow the nursing staff to assist you with your toileting needs before your session, either with a bedpan, a urinal, or a bedside commode. Remember, your first session is for your physical therapist to assess what you are able to do, and you may not be safe to walk to the bathroom yet, as you might be experiencing those possible side effects of anesthesia, such as dizziness, lightheadedness, or nausea. If you are able to walk at least 25 feet without getting lightheaded or dizzy, then we can safely assist you to the bathroom and your nursing staff will be able to continue with this level of support. If you are unable to walk that far without getting dizzy, staff will assist you to use the bedside commode or the bedpan for your toileting needs until you are able to walk to the bathroom. Thank you for your time. I hope this has been helpful. Congratulations on your decision and thank you for choosing New Hanover Regional Medical Center Orthopedic Hospital. I hope to see you soon.